Hello, a warm welcome to you from SGT University. I am Dr. Nimi Jose from the Department of Psychiatry, Faculty of Medicine and Health Sciences. Today we will be learning about intellectual disability.
So what is intellectual disability? It is a developmental disorder characterized by limitations in both intellectual functioning and adaptive behavior, which covers many everyday social and practical skills. It originates before the age of 18 years. This definition was given by the American Association of Intellectual and Developmental Disabilities. It was formerly known as mental retardation. Intellectual functioning is also known as intelligence. It refers to the general mental capacity of a person for learning, reasoning, and problem solving. How can we measure intellectual functioning? Through an IQ test. An IQ is measured by dividing the mental age by chronological age and multiplying by 100. Once intellectual disability is recognized, the level of severity is determined by the level of adaptive behavior. Adaptive behavior is a collection of conceptual, social, and practical skills that are learned and performed by people in their everyday lives. Conceptual skills. These are abilities that allow individuals to understand complex situations, to develop successful solutions. These include language and literacy, time concept, number concepts, self-direction. Social skills. These include competence, which facilitates interaction and communication with others using verbal and non-verbal ways. These include interpersonal skills, social responsibility, gullibility, social problem solving, ability to follow rules and obey laws, and avoid being victimized. Practical skills include skills performed by hand or using equipment, tools, or technology. These include activities of daily living, occupational skills, travel and transportation, schedules and routines, use of money, use of telephone.
So, what is the severity of intellectual disability?
It can be mild, moderate, severe, or profound intellectual disability. In mild intellectual disability, the IQ ranges between 50 to 70, and it represents 85% of population with intellectual disability. They can be educated usually up till 6th grade, and they are called educable. In moderate intellectual disability, the IQ ranges between 35 to 50, and they represent around 10% of population with intellectual disability. They can usually be educated up till 2nd or 3rd grade, and they are called trainable. In severe intellectual disability, the IQ ranges between 20 to 35, and they usually represent around 4% of people with intellectual disability. They are usually not educable, and they are dependent on their caregivers. In profound intellectual disability, the IQ is less than 20. It represents only around 1 to 2% of people with intellectual disability. They cannot be educated and they require life support. Coming to the causes of intellectual disability. Firstly, we will talk about some genetic causes. These include chromosomal abnormalities like Down syndrome, Turner syndrome, inborn errors of metabolism like phenylketonuria, single gene disorders like tuberous sclerosis, neurofibromatosis, cranial anomalies like microcephaly. Coming to perinatal causes, these can be infections like toxoplasmosis, cytomegalovirus infection, prematurity, birth trauma, intrauterine growth retardation, kernicterus, placental abnormalities, and drugs taken by a mother during the first trimester. We will be talking now about acquired physical disorders in childhood which can cause intellectual disability. These include infections, especially encephalopathies, cretinism due to thyroid dysfunction, trauma, lead poisoning, cerebral palsy. Deprivation of socio-cultural stimulation can also cause intellectual disability. Some psychiatric disorders can also have intellectual disability. These include pervasive developmental disorders and childhood schizophrenia.
Now we shall work upon how to reach a diagnosis of intellectual disability.
It requires a systematic workup, which includes a thorough history taking from the caregiver or parents, a general physical examination of the child, including a mental status examination, investigations, which include routine blood investigations, urine test, an EEG, chromosomal studies, CT scan or MRI of the brain, thyroid function tests. Some psychological tests which can be used for diagnosing intellectual disability include Stanford Binet test, Wechsler's Intelligence Scale for Children for 6.5 to 16 years, Wechsler's Preschool and Primary Scale of Intelligence for 4 to 6.5 years, Bhatia's Battery of Performance Tests, and Seguin Form Board Test. Coming to tests for adaptive behavior, these include Vinland Social Maturity Scale, Denver Development Screening Test, and Kessel's Development Scale. Coming to the differential diagnosis of intellectual disability, deaf and dumb children, deprived children, isolated speech defect, psychiatric disorders, systemic disorders, epilepsy. Coming to the management of intellectual disability, in primary prevention, we should work on the improvement of the socio-economic condition of the society, ensure good perinatal medical care, universal immunization, facilitating research activities, and genetic counseling. Secondary prevention includes early detection and treatment of preventable disorders, for example phenylketonuria, by a low phenylalanine diet, early detection of handicaps with early remedial measures and treatment, early recognition of the presence of intellectual disability, and early rehabilitation. Integrating people with intellectual disability in society to avoid segregation and discrimination. Coming to tertiary prevention, we should focus on adequate treatment of psychological and behavioral problems, parental counseling, institutionalization or residential care for people with profound intellectual disability. Legislation like Persons with Disability Act of 1995 and National Trust Act of 1999, which provide benefits for people with intellectual disability.
So today we learned about intellectual disability. In the next lecture, we will be learning about obsessive compulsive disorder. Keep learning, keep growing. See you next time.